Right, beta. So after the previously I told you about the poorly differentiated tumors, especially the medulloblastoma, the most common one. And now this is the time to discuss the meningiomas. Meningiomas, they are the benign tumors of the adults, and as the name indicates, they are the meningiomas, so they arise from the meningoepithelial cells. As you can see, beta, this is the dura mater, this is the arachnoid mater, this below is the pia mater, and can you see this is the tumor arising from the meningoepithelial cells and is attached to the surface, attached to the dura, right? This tumor can be found along the any surface of the brain, क्योंकि पूरे ओवरऑल सरफेस को मेनिंजेस ने कवर किया हुआ है ना, तो ये बाहर प्रोट्रूड कर सकता है, सरफेस ऑफ ब्रेन पे कहीं पे भी मिल सकता है ये ट्यूमर, या फिर अंदर की तरफ वेंट्रिकल्स की तरफ ये एक्सटेंड कर सकता है। ठीक है बेटा। The risk factor, possible risk factor for the development of this tumor from the meningoepithelial cells is the prior radiation to head and neck. If you have undergone this treatment, that is the radiation of the head and neck, so it is possible that later you can develop this meningioma, right? And these are some other dural based tumors. These are not the meningiomas, but they are also attached to the surface of the dura, like the metastatic tumors coming from anywhere else from the body. See a breast, see a lungs, it can separate from the lungs or from the breast to the meninges. Those are not meningiomas, right? But they are dura based tumors because they are attached to the surface of the dura, right? उसके अलावा solitary fibrous tumors, they are also the dural based tumors, but they are not the meningiomas. And some poorly differentiated sarcomas, they are also attached to the surface of the dura, but remember, they are not the meningiomas. What is the underlying molecular genetics? What are the underlying mutations that are responsible for the development of this tumor, meningiomas? Most common cytogenic abnormality, beta, it is the loss of the chromosome number 22. So chromosome number 22 पे एक particular site की डिलीशन हो जाना, जिसकी वजह से एक जीन लॉस हो जाता है. If this is chromosome number 22, so there is a deletion of particular portion, like this portion is deleted. So if this portion is deleted, there will be actually the deletion of what gene? NF2 gene. So if there is the mutation of this gene, NF2 gene, then what happens is there is the decreased production of the Merlin protein. Decreased production of Merlin protein, right? And when there is a decreased production of this particular protein, the susceptibility to develop this tumor from the meningoepithelial cells is increased, right? And meningiomas are very much common in the setting of the neurofibromatosis type 2. So if you are suffering from this disease, neurofibromatosis type 2 disease, if you are suffering from this disease, it is very much possible that you will develop the meningiomas, especially the high grade meningiomas. I hope you understand what I'm trying to say. What is the underlying mutation? क्रोमोसोम नंबर 22 का लॉस हो जाना, उस पर भी पर्टिकुलरली NF2 जीन का लॉस होना, एंड डिक्रीज मर्लिन प्रोटीन हो जाती है इसकी वजह से. ठीक है. न्यूरोफाइब्रोमेटोसिस टाइप 2 डिजीज़ की बड़ी एसोसिएशन है इसके साथ. इफ़ यू आर सफरिंग फ्रॉम दिस बैड डिजीज, यू विल develop the meningiomas, especially the higher grade meningiomas. So yeah, there are some other mutations as well. So mutations in the meningiomas without neurofibromatosis type 2 disease. Look, if I am suffering from neurofibromatosis type 2 disease, I will have meningioma in my meninges, and the underlying mutation will be loss of chromosome 22. But if I am not suffering from the neurofibromatosis type 2 disease, but still I have meningioma, then the underlying mutation is a little different. That is the mutation in the TNF receptor associated factor. TNF receptor associated factor 7, TRAF7. बात को आसान करते हैं. If you are suffering from NF, neurofibromatosis type 2 disease, if you are suffering from this disease, you can develop, there is very much possibility that you develop the meningiomas in association. But the meningioma can also develop solitarily. I mean, if you are not suffering from neurofibromatosis type 2 disease, still you can develop this tumor. In this case, the mutation is in the क्रोमोसोम नंबर 22 लॉस हो जाता है और उस पर NF2 जीन होता है जो कि लॉस हो जाता है. In this case, where the meningioma is not arising in association with the neurofibromatosis type 2 disease, in this case there is a mutation in the what gene? TRAF7. TRAF7 is the TNF receptor associated factor 7, right? In this case, where the meningioma is arising from the mutation in the NF2 gene in association with the neurofibromatosis type 2 disease, in this case, what type of meningioma do you develop? High grade meningioma, okay. And high grade meningioma, right? And if you are developing the meningioma without any association with the neurofibromatosis type 2, due to the TRAF7 mutation, in this case the meningioma which develops is the low grade meningioma, जिसमें क्रोमोसोमल इनस्टेबिलिटी काफ़ी कम होती है, ठीक है. इसमें क्रोमोसोमल इनस्टेबिलिटी काफ़ी ज़्यादा होगी, बहुत ज़्यादा इनस्टेबल क्रोमोसोम होता है. सो आई होप यू आर क्लियर नाउ. दिस इज़ द मेन थिंग. मेनिंजियोमा is arising from the, it can arise from the, it can arise in association with the neurofibromatosis type 2 disease, or it can arise solitarily without any association with any disease. It can arise in association with the neurofibromatosis type 2 disease, then the mutations are in the NF2 gene on the chromosome 22. If it is arising solitarily, then the mutations are in the TRAF7 gene. If it is arising in association with the neurofibromatosis type 2 disease, then the meningioma which develops is the high grade variety meningioma. And if it is arising solitarily without any association with any other disease, then in this case the tumor will be low grade meningioma. Okay, so we'll now be talking about the this part, morphology part of meningioma. So first look at this tumor grossly. It is very rubbery tumor and rounded tumor, bossylated dural masses, and they can compress the underlying brain but easily separated from it. So I mean to say, if this is the outer dura mater, this is the arachnoid mater, the pia mater. The tumor is right over here, right? And this is the tumor which can compress the brain substance which is present below here. This is the brain substance, obviously. This is the pia mater, right? This is the pia mater and below is the brain substance. ये इतना लार्ज ट्यूमर होता है, ग्रो करता है, काफ़ी राउंड होता है, रबड़ी होता है, नीचे ब्रेन सब्सटेंस को कंप्रेस करता है, लेकिन इस ट्यूमर को इजीली सेपरेट किया जा सकता है, ठीक है जी. Lesions range from the firm to finely gritty sand-like consistency of the tumor due to the numerous सेमोमेटस कैल्सिफिकेशंस. इफ़ यू, इसकी मैं जब माइक्रोस्कोपी बताऊंगा तो वहाँ पे बताऊंगा बेटा कि इफ़ यू लुक इनटू दिस ट्यूमर यू विल फाइंड सेमोमेटस कैल्सिफिकेशंस, जिसकी वजह से इसकी काफ़ी सैंड लाइक अपीयरेंस आती है. सो व्हाट वुड यू लाइक टू से if somebody asks you what is the gross appearance of the meningioma? So sir, it is very much rubbery tumor, rounded tumor, bossylated ड्यूरल मैस, इतना बड़ा होता है, काफ़ी राउंड होता है, नीचे ब्रेन सब्सटेंस को कंप्रेस करता है, लेकिन स्टिल इसको इजीली सेपरेट किया जा सकता है, ठीक है. इट कैन बी वेरी मच फर्म और फर्म टू फाइनली ग्रिटी सैंड लाइक अपीयरेंस इसकी हो सकती है, कंसिस्टेंसी इसकी हो सकती है. वाई? बिकॉज ऑफ प्रेजेंस ऑफ हार्ड सेमोमेटस कैल्सिफिकेशंस, राइट. ओके, नाउ there are some types of meningioma under microscope. One is the WHO grade 1 meningioma. So it should be kept as low grade meningioma or high grade meningioma. It is low grade meningioma, obviously. And I told you that low grade meningiomas they develop in association with the neurofibromatosis type 2 or they arise solitarily. They arise solitarily, right? And WHO grade 1 meningioma, it is a low grade meningioma, so it will be well differentiated as well. ये बहुत बुनियादी बात है बेटा, जो आप जब कोई आपको बोले ग्रेड 1 तो आपके जहन में क्लिक करनी चाहिए. ग्रेड 1 है मतलब लो ग्रेड होगा, वेल डिफरेंशिएटेड होगा, ज़्यादा अग्रेसिव नहीं होगा, रिकरेंसेस कम होते होंगे. और इस WHO ग्रेड 1 मेनिंजियोमा की भी 4 टाइप्स हैं बेटा, 4 पैटर्न्स हैं एक्चुअली. meningothelia, the fibroblastic pattern, the transitional pattern, and the semomatous pattern, right? Semomatous pattern. We'll talk about all four. Very interesting these are. The meningothelial pattern of the WHO grade 1 meningioma is the most common pattern. It contains the clusters of what cells? Say please. It is containing the clusters of epithelioid cells under the microscopy. Compared to the meningothelia, the fibroblastic pattern of WHO grade 1 meningioma, it contains the intersecting fascicles of the spindle cells with abundant collagen deposition. As the name indicates, the fibroblastic. So lots of fibers of the collagen are deposited, and the cells, tumor cells, are like more like fascicles of the spindled cells, right? What is the shape of the tumor cells in this variety? Spindle shaped cells, and their fascicles are present. Okay. In case of transitional pattern of WHO grade 1 meningioma, there is the mixed presentation. Meningothelial cells and the fibroblastic, both the cells are present. Look, mixed meningothelial and the fibroblastic features are found. That means इस ट्यूमर के अंदर मेनिंजोथेलियल पैटर्न भी होगा, यानी कि एपिथेलॉइड सेल्स भी मिलेंगे, और फाइब्रोब्लास्टिक पैटर्न भी होगा, यानी कि बहुत सारे स्पिंडल सेल्स और काफ़ी कोलेजन डिपोजिशन भी होगी. ठीक है जी. मिक्स्ड मेनिंजोथेलियल एंड फाइब्रोब्लास्टिक फीचर्स. इसके अलावा ट्रांजिशनल की एक और बहुत ज़बरदस्त करेक्टरिस्टिक फीचर है दैट देयर इज द प्रेजेंस ऑफ whorls. Whorls are present in the transitional variety of WHO grade 1 meningioma. What do you mean by these whorls? Whorls are like this, the concentric wrapping of the tumor cells around one another. Can you see? This is the one tumor cell, this is another tumor cell, another tumor cell, another tumor cell, another tumor cell, and you can see and notice the one tumor cell. You can see the tumor cells are actually surrounding each other. Tumor cells are actually surrounding each other, और ये पूरा एक whorl बना रहे हैं. So, there is the presence of whorls in the transitional variety of the WHO grade 1 meningioma. What do you mean by whorls? The concentric wrapping of tumor cells around one another. This cell is wrapping this cell, this cell is wrapping this cell, this cell is wrapping this cell. So, this is said to be the whorl which is found in the transitional variety. And the last variety of the WHO grade 1 meningioma is the semomatous variety, in which you will find lots of the semoma bodies, lots of semoma bodies. Okay, what are the semoma bodies? These are the concentric rings of the calcification deposited over the pre-existing whorls. जो whorls हैं उनके अंदर अगर बेटा क्या हो जाए, concentric rings of calcification. Can you see the rings of calcification, calcium deposition, another ring of the calcium deposition? These are said to be the semoma bodies, and this is the semomatous variety of the WHO grade 1 meningioma. I hope beta you are clear with all these four types. Then after WHO grade 1 comes the WHO grade 2 meningioma, जिसको atypical meningioma भी कहते हैं. ठीक है. It makes up the 1/4 of the meningioma, not really common, that means. और ये क्योंकि grade 2 है तो थोड़ा ज़्यादा अग्रेसिव होगा, ज़्यादा रिकरेंट होगा कंपेयर टू द प्रीवियस वैरायटी. And it can be distinguished from the lower grade meningiomas, especially the one we discussed above. So how can you distinguish this from the lower grade meningiomas? By having high mitotic rate and the brain invasion. This WHO grade 2 meningiomas, surely they will have high mitosis, because obviously they are WHO grade 2 tumors. Grade 2, that means high grade. High grade means high mitosis, poor differentiation, more brain invasion, right? और इस WHO ग्रेड 2 मेनिंजियोमा की, एटिपिकल मेनिंजियोमा की भी बेटा दो हिस्टोलॉजिकल टाइप्स होती हैं. वन इज सेड टू बी द क्लियर सेल, अनदर इज द कॉर्वाइड वैरायटी. ठीक है बेटा. सो दिस इज द ग्रेड 2 मेनिंजियोमा. देन कम्स ग्रेड 3 मेनिंजियोमा. ओके, लेट मी टेल यू अबाउट दिस ग्रेड 3 मेनिंजियोमा. ओके, grade 3 meningioma, it is said to be the anaplastic or malignant meningioma. It makes up 1 to 3% of all meningiomas. Obviously, as it is a WHO grade 3 meningioma. We discussed grade 1, we discussed grade 2, now grade 3. It will be poorly differentiated. It will be high grade. So it will be highly aggressive, highly recurrent. and even it often resembles a carcinoma or sarcoma, right? And it may arise de novo और द मेलिग्नेंट प्रोग्रेशन ऑफ द लो ग्रेड मेनिंजियोमास। हाँ बिल्कुल, ये तो बात है बेटा। पीछे हमने पहले ग्रेड 1 डिस्कस किया, फिर ग्रेड 2 डिस्कस किया, फिर अभी क्या डिस्कस कर रहे हैं, ग्रेड 3। तो ये हो सकता है कि या तो पहले ग्रेड 1 डेवलप हो, फिर उससे ग्रेड 2 में वो कन्वर्ट हो जाए, फिर ग्रेड 2 ग्रेड 3 में कन्वर्ट हो जाए, ये मेलिग्नेंट ट्रांसफॉर्मेशन। या ऐसा हो सकता है कि ये ऐसा ना हो, डायरेक्टली ग्रेड 3 डेवलप हो जाए। ठीक है बच्चों, सो इट कैन बी डीनोवो यानी कि डायरेक्टली डेवलप हो जाए ग्रेड 3 ट्यूमर, या it can be the malignant progression of the low grade meningioma into the high grade meningioma, right? Obviously it is very much aggressive tumor and the mitotic rates are very much high. The histologic variants of this tumor are number 1 the papillary variety and the rhabdoid variety. Okay, no details are given. Lastly comes the clinical presentation of your meningioma. Meningiomas, irrespective of grade 1, grade 2, grade 3, they are slow growing tumors and they are uncommon in children. More they develop in the adults. फीमेल प्रीपोंडरेंस इज देयर 3:2। अगर यही सेम ट्यूमर बेटा स्पाइनल मेनिंजिस से डेवलप होता है तो फिर तो फीमेल की प्रीपोंडरेंस और भी ज़्यादा है। ब्रेन में जो मेनिंजिस होती है उसमें तो 3:2 का रेशियो है ना, स्पाइनल के अंदर तो 10:1 का है। ओके, स्पेशली सेमोमेटस वैरायटी। यूजुअली दीज ट्यूमर्स आर सॉलिटरी, but if they are multiple they can be associated with the vestibular schwannoma and the spinal ependymoma, right? What did I say? I said beta that the meningiomas are usually solitary, that they are single in number, present isolated, but if they are multiple in number, then in that case the meningiomas are associated with the two other tumors, that are the vestibular schwannoma and the spinal ependymoma, right? And a very interesting thing about the meningioma that will help you diagnose this tumor is the expression of the variety of the hormone receptors, especially the progesterone receptors. Meningioma progesterone के receptors को express करता है. Can anything be beautiful than this thing? Currently, this is very interesting. There is a tumor called meningioma, and it shows on its surface the progesterone receptors. How easy it is to remember, to keep it in your mind for lifelong, right? So okay, this is the tumor carrying on its surface the progesterone receptors, and और फिर जाहिर सी बात है प्रेगनेंसी के दौरान क्योंकि प्रोगेस्ट्रॉन के लेवल हाई होते हैं तो रिसेप्टर हेल्दी होगा, रिसेप्टर ग्रो करेगा, और डिलीवरी के बाद ये ट्यूमर अगर रह भी जाता है तो फिर उसमें मौजूद जो प्रोगेस्ट्रॉन रिसेप्टर्स होंगे वो डिलीवरी के बाद रिग्रेस कर जाते हैं. सो दिस इज ऑल अबाउट बेटा द मेनिंजियोमास, and then we'll talk about some other tumors of CNS and then we are done with this part. ठीक है बेटा, ओके.